Hi, my name is Sandra Nardoni, and I'm just going to talk to you a little bit about the practicality of how you can use homeopathic medicines, and you can be sure that you're not going to be doing anything that's dangerous, that's going to interrupt anything else that you're doing with your medical procedures or anything like that. The way that the remedies work is that they're based on something called the law of similars. So this was discovered by Dr. Samuel Hahnemann back in the 1700s. He didn't want to actually use the types of approaches that the typical doctor was using back then, which included things like bloodletting. So that's not really a big shock. He was a medical doctor. He's a genius. He knew 7 different languages. And he actually was translating a medical paper and noticed that the doctor who had written the medical paper was saying that he could treat malaria with Peruvian bark. And he basically said he could do it because of its bitter properties. And Dr. Hahnemann was like, that's weird. That doesn't seem... It's a pretty elementary explanation. I wonder why it really works. So he actually made a tea out of Peruvian bark and drank it. And when he drank it, he got the symptoms of malaria, even though he didn't have malaria. And he came up with this concept that maybe if a sick person who had these same symptoms took this, it would cure it, because like cures like. And I don't know how he came up with that. That's a pretty genius thing to come up with, but that's what he did. And over the course of the next few years, he did a lot of experiments using different substances. But because some of the substances that he wanted to use, he knew they were toxic, he started diluting them down to where there was just a very small amount of the original substance in what he was giving to his family and friends, essentially, to try to figure out what they would cure. And what he realized was that the more diluted the solution was, the more powerful it was as a remedy. So it literally was removing the toxicity of the substance and actually highlighting the remedial aspects of the substance. And of course, in today's scientific terms, what they've discovered is that unless you're looking at nanomolecules, you are not going to find any. Now, I'm not a scientist, so I'm going at this from a very, layperson perspective, but you're not going to find any like normal sized molecules of the substance in the remedy. You could find nanomolecules, but that's only been very recently that they've actually been able to even see those. But the more diluted you get, the more powerful it becomes. And the concept is that it's the energy or the blueprint of the original substance that is actually curing whatever the problem is. And so as a result, because they are so diluted, they don't interfere with anything that is already happening with the patient. So if the person is taking a certain kind of medication, it's not going to interfere with it. The only thing that might happen is that allopathic medicines tend to be very destructive. Most allopathic medicines are, they have synthetic parts to them that are so destructive that the hope is that the healing aspects of whatever is in the medicine are going to be more powerful than the destructive aspects. And I mean, that's obvious from all the commercials that you see with the long lists of side effects. Homeopathic medicines don't have side effects because they're so safe, and they don't do that to people. They don't have side effects. So when you use a homeopathic medicine, it really doesn't matter what you're doing. Like if you're talking about a bone infection, there's a protocol to take for a bone infection. It doesn't really matter what other medications you're taking, what other treatment you're under. If that homeopathic medicine is right for you, it will start to work on the pathology that is causing the symptoms of your bone infection. If it's not the right medicine for you, it just basically won't do anything. It doesn't interfere with medicines. It doesn't interfere with treatments. It is so incredibly safe. A baby could come and eat an entire bottle of a homeopathic medicine and you wouldn't even have to call poison control. There's never been one documented case in the 250 years that homeopathic medicines have existed where someone has overdosed or died because of one. And you can't say that for any allopathic medicines, I don't think. I don't even think there's probably one that exists that hasn't at least had a severe injury attributed to it. So when you talk about remedies, it's more of a general thing. Whatever it is that you're trying to fix, you are either going to have a result or you're going to have no result at all because it's not the right medicine for that person's body. But for the most part, when you use protocols, they've been tested by the Doctors Banerjee in India and extensively documented for the last 55 years. The clinic itself has been around for 150 years, but the documentation in the research center has been going on for the last 55 years. They have computers full, hard drives full of all of the information about how these medicines have affected people and what works and what doesn't work, and all the protocols for the different types of illnesses and disease. So when you use their protocols, you really can trust that you're doing something that is more than likely going to be effective, unless for some reason that person is either too far gone or their body doesn't respond to it for some reason. Often because of allopathic treatments or medicines. That is usually the reason why a homeopathic medicine doesn't work. They find that when people have not had a lot of medical interventions, that homeopathic medicines work amazingly well. So that's kind of a little explanation about how these medicines work from a very lay person perspective, and why you can trust that you're not going to be doing any harm if you use them, if you try the protocols that the Banerjees especially have put forward, because they're backed by literally 55 years of scientific research. And these doctors have been working with over 1,000 patients a day for literally over 100 years. There's 12 doctors typically in the clinic, and each of them sees around 100 patients a day, because all they do is they hear what their diagnosis is and what their symptoms are, and they already know what the protocols are for those diagnoses and those symptom clusters, and they give them those medicines and send them on their way, and they work. So I hope that explains that to you if you have any questions, and I'll talk to you later.